Hi, and welcome to our third workshop in our COVID-19 Navigating the Unknown updates and free coaching series. So we're very excited to be here with you today. Just for context, we know that there's a lot of emotion out there, a lot of anxiety. There's so much going on with people feeling fearful, negative feelings, and also having a lot of positive emotions and experiences that are sort of unexpected. So we're navigating all of that. We're here to help you to process that and to explore that as life coaches and also as a doctor and a communication coach. And we also are so honored and happy to have Dr. Melissa Kwak here with us every week to share medical updates. She's on the front lines with all that's going on in the medical community and learning about this virus. And so she'll be updating us every week with the medical information. And today we're bringing new information as well as reviewing some of what we have covered in our first two workshops. Our two workshops that we held prior to this are available for you to watch on my YouTube page. It's Sampson Coaching and Consulting. Super easy to find, but if for some reason you can't find it, just let me know and I'll tell you where to find that. So whether it's the anxiety that you're here for, wanting coaching, or just really hungry for really reliable medical updates from a medical professional, or all of it, that's what we're here to provide today. So the plan for today is to review the self-coaching model very briefly, and this is just a tool that we want to offer and share because it's been so helpful to us. So we learned it in our life coaching certification program. We're going to review it super quickly and then give an example of it. You're welcome to ask questions as we go through that process. And then Dr. Kwak will offer medical updates, and she'll also be bringing in some new content around cognitive dissonance, which a lot of us are experiencing and will be really helpful to hear. And then we'll open it up for coaching. So whoever is game to come on live with us and get a little coaching, we're happy to bring you on and happy to help and support you through, to talk through and to provide some assistance in just digging into what's going on for you and how you want to feel about it and how you want to look at it. So that's a preview of what we've got for today. I am going to start with the self-coaching model. This is a quick review. If you haven't been exposed to it before, I highly recommend that you go to the Life Coach School podcast. Very easy to find. Brooke Castillo, and episode number 1 explains in depth for about 20 minutes this model. But here it is, really brief. A circumstance is a fact. It's 100% fact in the world. It's something that's happening or something that someone does or says. It's something that is, everyone would agree, is a fact. Then a thought is a sentence in your mind that you have about that circumstance. A feeling is, a sensation in your body: sad, happy, upset, angry. And the interesting thing that the self-coaching model helps us understand is that our feelings are generated from our thoughts, not from the circumstances. So I used to think, before I learned all of this a couple of years ago, well, if something happens out in the world, I feel a certain way about it. And that's the cause and effect relationship. Now, understanding that it's actually my thoughts about that event out in the world that create my feelings is so empowering and so mind-blowing to help me see that I have much more ability to be aware of what I'm creating in my feeling world and my emotional world with my thoughts, rather than just being at the whim of what's happening out in the world, thinking that that's what creates my feelings. The feelings then drive our actions, what we do or what we don't do. And it's how we feel that leads us to engage in certain behaviors or not engage in behaviors that we would like to engage in. And the result is the outcome, right? So it's, what is the result of this whole cycle, this whole situation? And the result provides evidence for the thoughts. So that's a really quick overview of it. I think it really helps to look at the examples. And what I decided to do for today really quickly is go over the concept, which is called buffering. But I also want to bring in a tiny bit of legitimacy for this model, because I want to share with you that it's supported by many, many fields: psychology, spirituality, philosophy, definitely psychotherapy. And one form of psychotherapy in particular is cognitive behavioral therapy, which teaches us that in the cycle of how we think and feel and respond to things in the world, our thoughts create our feelings create our behavior, and our behavior reinforces our thoughts. So this says exactly the same thing. If you look at these two models, it's just a different way of saying the same thing. And this is backed by so much psychological research and study over many years. And it's a very powerful form of psychotherapy helping with anxiety. Now, we are not psychotherapists, but we are life coaches. And so we use the self-coaching model as our tool, which we can look at all 5 of these factors: the circumstance, the thought, the feelings, the actions, the results, with the clients we're coaching, to help them see and create awareness and a little ownership. It's never meant to be judgmental or for anyone to say, oh, I shouldn't be doing this, but just to create awareness. And that's a tool that we use as life coaches. And there are many other approaches and tools that use the same kind of a system. So here's the simple example that we gave in workshop 1, and I wanted to really briefly just put it up here again. If you haven't seen our first workshop, please watch it on YouTube. We gave this example where someone's thinking, this is so scary. That is what's generating the feelings of being scared, of fear, not the fact that the coronavirus exists. The action might be for one person watching news, kind of getting consumed, scrolling Facebook, talking to other scared people. And the result is remaining in this feeling of being scared a lot of the time. Now, we're bringing in a new concept today that's called buffering to use in looking at the next example of the self-coaching model. And I highly encourage you, if you want to do something interactive to work through this, to actually write this all out and think about a model for yourself. Write down the C, the T, the F, the A, and the R, and see if you can fill it out and plot in all of the elements for your situation, whatever it may be. What's the circumstance? What are the thoughts you're having? What feelings is that generating? Then what action are you taking? And what's the ultimate result that you're finding? But let me talk for a minute about buffering, which Dr. Kwak and I learned a lot about in our life coaching certification program, because it's quite an interesting phenomenon. And to be fully transparent, we all do it. I do it. You probably do it. And pretty much everyone we know does it. And buffering, I actually have the definition, the official definition from our coaching certification program, but I know you already know what it is, but just to give you the official definition, buffering is when we use external things to change how we feel emotionally. It's something we do to keep from fully experiencing our lives, to hide from reality, to procrastinate, to not show up and face the music. We don't want to face the truth of our lives because we don't want to experience negative emotion. We know that sometimes the negative emotion feels like too much, so we buffer it, right? And so we buffer it with something that feels pleasurable in the moment. We all do this. It could be food, it could be alcohol, it could be excessive time on social media, shopping, sex. I mean, the list is endless. You know this, right? And so we wanted to give a buffering example. Again, please not to feel any sense of self-judgment. This is something we're all experiencing. And I've noticed more people being aware of it, questioning it, wondering about it. I've been having many life coaching sessions and executive coaching sessions with all of my clients in these past couple of weeks. And several clients who I've been working with all kinds of issues on over the years have brought up the issue of buffering, even if we've never talked about it. So one client was like, well, I don't know, I'm drinking more wine at night, I'm noticing, or I'm eating a little more food, and I think it's to soothe what I'm feeling about the virus and everything we're going through. So just know this is coming up for a lot of people, and we want to have self-compassion about it. Another resource or person I wanted to mention is Glennon Doyle. We've talked about Brene Brown and Glennon Doyle. They're buds and they work together. And Glennon Doyle has been posting some really powerful messages on Instagram if you want to check her out. But I saw a video that really moved me where she talked about how people who have eating disorders, which she identifies as having had in her life, may be struggling in unique ways right now and are responding differently to all these memes that people are spreading with jokes about drinking too much or eating too much, that sort of thing. So just being really sensitive and mindful and compassionate to ourselves and compassionate with others and really judgment free, I think, is so important. So here's the quick example. see if you can relate to this, right? So we're using the self-coaching model. The circumstance is still the coronavirus, and maybe also that we're all practicing safer at home, so we're not going out unless absolutely necessary. A thought, and this thought may be at the subconscious level, or maybe something we're conscious of. I'm so stressed, I deserve another piece of cake. So imagine in the moment, I've already had a piece of cake. Maybe, I'm loving seeing all the posts. People are baking bread and cake and all these wonderful treats, right? So I've decided maybe ahead of time I'm gonna have one piece of cake. But because I'm having these so many stressful thoughts, I'm thinking I deserve another piece of cake with everything that's going on, right? And the feeling that generates is this incredibly powerful desire and urge. And so the action, of course, is I eat that second piece of cake. That may result in more stress. So it reinforces the cycle, right? About, well, now on top of the stress about the coronavirus, on top of the negative feelings I was feeling, which are still there because buffering doesn't actually, in the long run, fix anything or soothe the feelings, right? So now I may have, some people may not. Some people may be like, well, just ate that other piece of cake and no problem. It's all different for each of us. We just want to look at what's going on, right? So it may generate, I know for me, when I was struggling with overeating, then I would overeat and I would have more stress about the overeating and then a stronger desire to eat more to soothe that new additional stress. So I'm gonna go to the chat. We have a question in chat. Okay. Definitely, absolutely. Guilt, fear of gaining weight, right? So I appreciate that, and I appreciate your honesty, and I want to share with you that I have dealt with overeating, buffering, with over drinking, and this is also, I really want to say, I really think it's important to have the disclaimer that we're not talking about addiction and we're not talking about alcoholism. So for someone who's identified and knows that they're an alcoholic or overeater, going to Overeaters Anonymous, things like that, that is not the realm of what we deal with in our life coach program. And we encourage and support people to find support in those programs. We're talking about, for me, I'll just say personally, overeating, over drinking, over shopping, over social media-ing, if that's a term, are definitely things that I've struggled with at various points in my life and use them as buffering. And so there's a different, but I am not an alcoholic and I am not someone who's an overeater, a compulsive overeater. So you have to decide for yourself, but this can be a helpful tool just to see it. Really remember, please have self-compassion. We're just looking at awareness here. So let's look at a second example, okay? And really there's probably a long journey between the first example I gave and this example. So let's not look at it and be like, oh, I can just in the moment change what I'm thinking and change how I'm acting around food or whatever I'm using to buffer. But with some work and some awareness and some usually sitting with really difficult feelings, that's part of the process, is I'm going to have to feel what I don't want to feel. And that can be very hard to do and can, I couldn't do it myself without a lot of coaching with my coach. So just go through this quick example and then I'll check in the chat again. So this is a second example of how it might look. The thought now is, I might want more cake. I know I want more cake and I want it really badly, but I know I'll feel better if I stop after the first piece of cake, right? And the feeling then is determined. And there may be many models in between what I showed you before and what we're showing now, of going through difficult feelings and struggling with it and urges. But let's say we've gotten here, I want more cake, but I know I'll feel better if I stop is the thought. So I feel determined. So then the action is I'm able to not eat the cake. The inaction is not eating the second piece of cake. And the result in the moment or in the long run, an hour later, the next day, whatever, is I feel really good about not having eaten that cake, even though I really did want it in the moment. And the result provides evidence for the thought. So let's see if we have any questions about this. And you're welcome to unmute. Anyone is welcome to unmute yourself. Okay, so people are really just saying in the chat that this makes sense, which I so appreciate because it's just such a human phenomenon, and we just are talking about seeing it. And if you really want to work on it, there's a lot to it. And so for me, I did my overeating and over drinking work about 1.5 years ago. And so where I am now with it is I'm just an entirely different person. And I'll share with you if this really resonates and you want more on it. On my YouTube page, Sampson Coaching and Consulting, I have a full hour workshop called Curb Your Cravings, and it's free. It's just there, sitting there on the YouTube page, and it dives into all of this in much greater depth for a full hour, how to work with all of this and how to use the self-coaching model and many other tools for understanding how this cycle works and how we can interrupt it if we want to. So here's the last thing I'll say is one really quick way to understand how to interrupt this buffering cycle is to decide ahead of time for your thought in the self-coaching model to be, I can decide ahead of time how much I want to eat and drink. And the recommendation is for us to be using our prefrontal cortex, which is our thinking evolved brain, rather than our reptilian brain, which is just all about instant gratification. We have to plan ahead, or we want to strive to plan ahead 24 hours what we will eat or drink, right? So for example, I'll be honest, I'm going to a Zoom happy hour today at 5 p.m. and I know I'm gonna have exactly one drink and I know exactly what it's gonna be and I know exactly what I'm gonna eat for dinner. I know it sounds so boring, but it feels so great and amazing to have, you know, that to feel the healthiness of my body and to feel not in control, but just that I'm making the choices that I want for my greater good rather than that instant gratification in the moment. And the second part of that is really thinking I will keep my word to myself, because urges can be so powerful and the desire can be so strong, and we understand that. And there are so many tools to help us to work through that. And so that's a really brief introduction to using the self-coaching model for understanding buffering and understanding that. It seems like from the response I'm seeing, people are just saying, yes, this makes sense, it resonates. And just please, 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 I hope that you are feeling compassion for yourself and knowing this is so normal, this is so human, and this is our brains wired to, you know, to do things that make us feel good, to keep us alive and keep us safe. And it just sometimes it does that in ways that don't serve us in the bigger picture. And we have the ability to use tools and use coaching and use processes that are available to us to work with that if we want to. And so I am going to, I don't think we have any questions. Last call for questions on the self-coaching model or on buffering before I turn it over to Dr. Kwak for medical updates and more great information that we can use to understand what's happening in our minds and with our emotions and how we can support ourselves. So questions? Okay, I am going to stop the screen sharing and turn it over to Dr. Kwak, who I'm so honored to have here, our family physician.
Awesome. Thank you so much, Bridget. So I'm Dr. Melissa Kwak, a family physician in full-time outpatient family practice. I've been out of residency for almost 11 years now. And just a quick disclaimer that everything I talk about and say here is totally my opinions, my words. I'm not representing my employer. I am an employed physician or anyone else. So with that, just a few reviews and updates on the coronavirus. So as you probably all know by now, but this coronavirus is brand new to humans as far as we know. We didn't know if its existence prior to the emergence of the cases out of China. And as such, there is not much that we definitively know about this virus yet. What we do know is it appears to be transmitted primarily via respiratory droplets, especially if you're within 6 feet of contact of someone else, or if you've touched contaminated surfaces that someone who has the virus has also touched. There is some emerging evidence of possible fecal oral transmission as well. It appears that some people do shed the virus in their feces as well. So there is that possibility, but we still need to learn more about that. The symptoms can range pretty greatly, we're finding out. We're still thinking that I don't know about the majority, but a large percentage of people are asymptomatic or minimally symptomatic, which is one of the reasons this is spread so easily. For people who do have symptoms, it can range from seemingly mild cold symptoms, a runny nose, a scratchy throat, a little cough, or even mild gastrointestinal symptoms, some stomach cramping, some looser stools, decreased appetite, all the way to, as we know, severe respiratory symptoms and respiratory failure. and everything in between. So that the symptoms are vast, and it seems like just about anything goes for symptoms. But the symptoms that we're most concerned about in terms of a case presenting as a more severe case are the respiratory symptoms, the chest pressure, the shortness of breath, the chest heaviness, severe cough. Those are when we are getting more concerned and seeing people get sicker than we'd like. So the big movement in the world and in our country now is still to do what we call flattening the curve, which means trying to slow how quickly this virus spreads through the population, to slow the number of cases of this infection at one time. Because the more people that have the infection at one time, the higher the likelihood that our healthcare system is going to be completely overwhelmed and inundated, and we won't have the resources to care for the sickest of the people that need those resources. Unfortunately, there are some areas you've probably heard in our country that are starting to experience that, primarily New York. But thankfully, there are other areas that it appears so far the early measures they took to try to flatten the curve are working. And San Francisco is the one that I've seen coming to light with that they were the earliest to implement very strict measures of social distancing and staying at home. And it looks like the numbers so far are promising that the curve is flatter than the predicted models were. They're hoping that that's going to continue to work there and keep the hospitals from being overwhelmed. So we're definitely seeing how important it is to take these measures seriously. I know some states haven't implemented strict stay-at-home policies yet. I don't know if those will be coming. I very much hope that everyone individually, whether their state has mandated it or not, is taking this very seriously and not exposing themselves to other people absolutely as much as possible. Again, keeping in mind that so many people, possibly 25% of people, plus or minus, are spreading this without even knowing that they're sick. So a few changes, I guess, since the last time we talked. Well, the current numbers in our country as of today, according to the CDC, there's been 213,144 reported cases of COVID and 4,513 deaths. Those numbers by themselves are giving a 2.1% mortality rate. And again, I want people to keep in mind though, and this is not to take this less seriously, and certainly not to encourage us to not practice social distancing, but just to look at the broader picture. We think the death rate is going to be lower than that 2.1% for sure. The Lancet is a pretty highly regarded journal that gives peer-reviewed studies. They recently published an article predicting that the death rate of COVID will probably be closer to 0.6% overall. But again, in this country, we have such limited access to testing that there's unknown number of cases or people that actually do have it or had it and would have tested positive, but we would never have that data to report. So presumably the denominator of this equation is much larger than the reported 213,144. And just anecdotally, in my experience, I've been able to get a test performed on maybe 10% of my patients who call who have symptoms that very much seem like a COVID infection. And the majority, I can't get tested for it. But thankfully their symptoms are mild to moderate and they're just staying at home and isolating. So yeah, like I said, in my experience, it's maybe 10% that I'm able to get tested. What else is new? So the thinking on wearing face masks more generally has changed a little bit. So initially the report was for the general person and population not to worry about it. But we're finding that because there's such asymptomatic spread of this, that wearing just a standard either surgical face mask, so I'm not talking the N95 for the standard person, like for the general population, but just a standard surgical mask or even a cloth wrap around your face and nose, that can probably decrease the rate of you asymptomatically spreading an infection to someone else. So these aren't for the general population to so much to protect yourself, but it's to protect others from you possibly spreading a minimally or asymptomatic case to them. So I don't know that this has officially become a recommendation, but not a bad idea if you're going out in public at all to wear something to cover your mouth and nose, whether a basic surgical mask or cloth around you, to not be an asymptomatic spreader of this. What else has changed? I don't know that a whole lot else has changed, but I just wanted to comment on a few things that we definitely don't have answers to yet. One is how long this infection is here to stay. We don't know. There's some, I guess, theories that this could become a cyclic or seasonal type infection, kind of like our seasonal influenza that we have now. So that seems to be a possibility in the experts' minds, but even that is still, I don't know if conjecture is the right word, but we're still not sure. So we don't know. We don't know if this will be cyclical or burnout or not. We don't know. And I guess to follow that a bit, how long will social distancing be recommended or needed to continue to flatten the curve? And we don't know the answer to that either. We're kind of at the mercy, I guess, a bit of the experts who are doing the number crunching, which seems to be based on very solid data, the best data we have, doing the number crunching and watching these curves and seeing the impacts of social distancing in various parts of the world and parts of the country and what impact it has. So we're gonna have to keep following their advice and suggestions, in my opinion. But for now, we don't know. And then, yeah, I think that was actually all my comments on that. So yeah, were there any questions or comments that came in with the medical?
So a question that came in was, are ATBX always prescribed if an individual has the lung symptoms, or are you waiting for more significant symptoms before starting them? And what would initial treatment look like?
Yeah, so on the outpatient level, which is where I am and my coworkers are, there aren't any, there's no treatment recommendations beyond symptomatic care and supportive care. So for, that could be just, over-the-counter pain relievers or fever reducers for someone who might be asthmatic, using their inhalers or nebulizers. So we're just using symptomatic treatment on the outpatient scale. Yeah. Inpatient, it depends on your hospital, but I know our hospital, the infectious disease team, has just poured over the literature and the data and talked to other specialists across the country and possibly the world, I'm not sure. And they've just come up with their own standardized treatment plan, which does include Zithromax, which you may have heard of. That's an antibiotic that's used for other types of infections. And they're also including a few of the antivirals that are being studied right now. And I guess to further talk about that, there's still aren't, I guess you would say, approved treatment recommendations or guidelines for this. The treatments that are being used are still under investigation, but they're being used, the treatments are being used nonetheless. I think they're calling it compassionate use, or maybe even investigational use. I'm not sure, but to my knowledge, nothing's still been like FDA approved and standardized yet. But yeah, so my hospital has been using some antivirals and Zithromax. But my understanding is also that each healthcare institution, I think, is kind of coming up with their own protocols. But I imagine they're all in systems are at least somewhat in communication with each other and helping devise these plans. Let's see, how safe is it to eat food? So yeah, that's a good question. So from what I've read, we don't worry so much about the food. I mean, if you're getting produce from a store, you should be washing it per usual. But whether, the packaging, if that was touched by someone who, had their hands contaminated, I mean, that would be something to consider. So I'm if I get carry out, I'm just kind of assuming this is a contaminated surface and treating it as such. So if I get carry out and I take the containers and when I'm done taking the food package out, I wash my hands and then do whatever. I just wash my hands after touching anything that someone else touched, or use hand sanitizer, and then go from there. Yeah. So that's how I'm kind of doing that.
There's a really popular video out there, and I can't remember the name of it at the moment, but where a doctor has recommendations for how to sanitize your items when you get them home from the store, or if you've had delivery to your home or done takeout. So if anybody knows the name of that, it's Dr. something. It's like got millions of views, and I would just look for that. I'm so sorry we don't have the reference right now, but come back to me if you want it. But and so there's another question. I don't know if you already saw it, about would lung symptoms include green sputum? I didn't even know that word, but I looked up the word and it's, yeah, you know what it is. Okay, go ahead. Would that be a symptom?
That is so, yeah, I mean, sputum is like mucus that you either produce or like produce from your, that you like cough up and produce. So it's like gunk. It's the gunk that you see. And yes, I mean, it could be, but that could be a symptom of, allergies or run-of-the-mill bronchitis or run-of-the-mill cold. So, I mean, unfortunately, that's kind of true of just about all of our symptoms with this COVID, is it could be COVID, or it could be, a run-of-the-mill infection that we also see this time of year. So, I mean, truthfully, how I'm practicing medicine is anyone who calls me with respiratory or GI symptoms, I'm assuming they have COVID, just assuming it. And then asking myself, okay, assuming everyone has it, like who has these symptoms, what else could it be? Mm-hmm. Just to not have my COVID blinders on and see if anything else makes more sense or as much sense, or if we need to look for anything else, and kind of going from there. But that's just been my approach.
Okay. Just to go back to, I looked it up, the video that I would recommend, I watched it, and I know a lot of people are watching it, is by Dr. Jeffrey Van Wingen, and it's on YouTube, and it's called How to Safely Grocery Shop During Coronavirus. And he goes into, it's 8 minutes, so it goes into some really great detail on how to sanitize everything very carefully. And I just wanted to share that since we had a couple specific questions about that. I know you had a great story to share with us and some new ideas this week, Dr. Kwak.
Yes. Okay. Let's see. I'm going to try to keep this to 10 minutes so we can get a coaching. Although I'm free to coach a little longer if we want to stay past the hour, like we did last time.
We'll stay longer if we need to. Yeah.
Okay. So I'm going to read a story, shifting gears a little. I want you all to kind of close your eyes and settle in while I read this story, and just let whatever comes up, or feelings or whatever thoughts come up, but just try to be present with this story. And maybe you've heard this story before, maybe not, but every time I hear this story, it hits me a little differently. I swear I could take like a semester-long college course just dissecting this story. So here we go. Once upon a time, there was an old farmer who had worked his crops for many years. One day, his horse ran away. Upon hearing the news, his neighbors came to visit. Such bad luck, they said sympathetically. Maybe, the farmer replied. The next morning, the horse returned, bringing with it 3 other wild horses. How wonderful, the neighbors exclaimed. Maybe, replied the old man. The following day, his son tried to ride one of the untamed horses, was thrown, and broke his leg. The neighbors came again to offer their sympathy on his misfortune. Maybe, answered the farmer. The day after, military officials came to the village to draft young men into the army. Seeing that the son's leg was broken, they passed him by. The neighbors congratulated the farmer on how well things had turned out. Maybe, said the farmer. The end. Have you guys heard that story before? Yes. I mean, feel free to share your thoughts or feelings on that in the what comes up for you if you want, either in the chat or coming on. But well, there's so much I love about that story, and there's a lot of like feeling and thinking that can come from that. But I want to take some of the fun out of that thinking and feeling about it, and talk about it in a little bit of a scientific or neuroscience-y way, I suppose. So the concept I wanted to talk about based on that story is a concept called cognitive dissonance. We'll come back to that story in a sec, but a lot of you, maybe you've heard of this concept before too. So can you see okay? Okay. So cognitive dissonance. So the term cognitive is relating to intellectual activities, such as thinking or reasoning. And the word dissonance pertains to a lack of agreement or inconsistency or discord. So this word comes up a lot in modern psychology because cognitive dissonance is at play in our lives pretty much constantly, kind of in the background. So in the psychology world, this term cognitive dissonance refers to the psychological discomfort or the emotional discomfort that comes from holding conflicting beliefs at the same time. So I was going to give an example of smoking here, and I still can quickly, but I wanted to go back to what Bridget had talked about in her models to give an example of cognitive dissonance as well. So someone who smokes may hold conflicting beliefs at one time in their life, like smoking is good, and they can have proof of that, right? It relieves my stress. It's not that bad of a habit. It's like there can be reasons for believing smoking is good. And then they can also hold at the same time the belief that smoking is bad and have reasons for that. What their doctors tell them, what they read in the literature about the negative health consequences of smoking. So if a human being just stayed in that space of trying to believe at the same time that smoking is good and smoking is bad, that creates an emotional or psychological discomfort in that space. And our brains do not like discomfort. We kind of touched on this last week a bit with the primitive brain and the prefrontal. The primitive brain, Bridget also called it the reptilian brain. So that brain, part of its job is to get us out of discomfort. It's going to do what it takes to seek comfort, or believe the term psychologists are using for this is cognitive harmony. We desire cognitive harmony. Our brain processes desire cognitive harmony. It expends a lot of energy to live with two different beliefs. The brain likes pattern recognition. The brain likes to find evidence for what it already believes is true, which is why our belief systems so easily get reinforced and solidified, because when we have a belief, our brain will look for evidence for it, reinforcing that belief. And that also helps create this cognitive harmony. So our brain doesn't like cognitive dissonance. We don't like cognitive dissonance. It's uncomfortable. So what naturally happens is our brain will naturally seek ways to get out of that discomfort, to resolve that dissonance. So I see three main ways that we can resolve this cognitive dissonance. One is to change our attitudes or beliefs. So for the person who might have discomfort from thinking smoking is good and smoking is bad, they might change their belief. Like, oh, maybe smoking isn't that bad. Maybe all of the literature that's out there is overhyped. Maybe it's really not that bad. And then they'll find themselves more comfortably over here, able to live just in this belief system here that's much more comfortable. So another way to get out of cognitive dissonance is to change our behavior. So back to the smoking example, to get out of that discomfort of it's good and it's bad, someone might decide, well, I'll stop smoking then, and then I don't have to hold this conflicting belief that smoking is good. And now I'm squarely over here into this category, smoking is bad, and I stopped smoking to further prove that to myself. And now the brain is happy with reinforcing this belief over here. Smoking is bad, and I don't smoke anymore because it's bad, and we've resolved some of that discomfort. And then a few pointers here is that, a lot of this is happening subconsciously or minimally consciously. And remember that the primitive brain, when things are happening subconsciously, we assume that's more the primitive brain that's at work, that brain that's seeking comfort, that brain that's seeking what's the easiest way to get to a solution here, what's the easiest way to get to comfort. It's not necessarily going to be automatically the healthiest way, or the way that you think consciously you desire, the way that your prefrontal cortex thinks about, for example, smoking. Like the prefrontal, the conscious brain might think, I want to quit smoking, I think that'd be healthier, but it might be easier, a simpler pathway for the primitive brain to instead decide, well, maybe the risks aren't that bad, maybe it's really not that bad for us. That's probably the path of least resistance. For the brain to instead come up with a plan to quit smoking can be very energy consuming and overwhelming for the brain to think about, which is why it's so easy to get stuck in bad habits, because it's the path of least resistance to just change our beliefs about it, as opposed to changing the behavior. So the primitive brain is at work. The third way, and this is my opinion, I don't know if I've read literature on this or expert opinion on this, but I think this way is the way, if we're really conscious of what's going on, like when we've really been able to separate ourselves from our life experience a bit and kind of become the observer and kind of watch what we're doing and watch how our brain is working in situations, when we're gaining more awareness and more consciousness of that, I think number 3 becomes a bit, I don't know if easier is the right word, but maybe perhaps more helpful, or at least a resting place before deciding which side to pick in terms of the belief systems that you're holding that are conflicting. And that's to recognize the discomfort of being in cognitive dissonance, recognize when you're there, and be able to sit with that discomfort and explore it and get curious about it. Like, what's behind this? Like, what are my conflicting beliefs here that I'm wrestling with, and what is going on? And this is where I think the farmer in that story has gotten to, and why I wanted to talk about this concept from that story. For most humans, we have a belief system that there's good in the world and there's bad in the world. And to not be in cognitive dissonance, our brain likes to immediately categorize everything into one of those buckets, right? As opposed to that gray area of, well, what if something's both? Or what if it's neither? Or what if, that gray area can be very uncomfortable for the brain. So to be able to categorize into buckets feels much easier and brings cognitive harmony into our lives. So the farmer was able to, I think, sit with what I think is a reality, that maybe it doesn't make sense to categorize a lot of things in the world, or maybe you can categorize, but it's more nuanced. Maybe just 2 simple buckets of good or bad doesn't make sense for a lot of things. And he was able to see that how when you zoom out, the picture gets much bigger of, not being able to make sense of each single moment is either good or bad. So if we get to number 3 and are able to get to this landing place, I think that can just help prevent tunnel vision of getting too stuck in one pathway and not being able to see any other kind of possibilities of what's going on, or what could be the outcome of what's going on. And this, well, it kind of allows for and honors the nuances and gray areas of life, which is so much of life, in my opinion. So, and then just really quick to touch on Bridget's examples from the models that she gave. There can even be cognitive dissonance in so many ways, even with just that piece of cake, right? So you can hold the belief, I'll feel better if I don't eat that piece of cake, But you might also have the belief at the same time, wait, no, I'll feel better if I eat that piece of cake. Like that's going to be like an immediate reward right now. So you've got those two beliefs. I'll feel better if I don't. I'll feel better if I do. And then there's that wrestle of trying to like get to one side or the other. And often the primitive brain wins out and goes with the easiest path, which is the cake's going to be good right now. Let's go do it. So that's what I had to say about cognitive dissonance. So thoughts, questions, perspectives, insight.
I know for one, I'll say, this is Bridget, I could relate so much. And the way you explained that was so helpful. And I think it's just like we talked about with buffering is part of the human condition, that cognitive dissonance and constantly trying to resolve it is part of the human condition. And I could see it. I could think of so many examples in my own life as you were teaching us that. So thank you. What you could just pop in next week. We'd love to see you again. And love so much and gratitude for all of you. Thank you. Bye, everybody.